Now, so some of the risk factors, I know you spoke maybe smoking, certain cases of genetics that I looked up, like von Hippel-Lindau or uh, even cases of neurofibromatosis. There are certain brain cancers, and there are, from what I understand, about 200 different type of brain cancers. What do you think this type of cancer is? Can you hear us? There's a little bit of interruption in line.
I can hear you. I think that it's likely, given the way that this played out, that it was just a very aggressive glioma. They may have found it when it was small, but without knowing the specific pathology and certainly not wanting to, jump to any conclusions, if a tumor comes back this rapidly and is this aggressive, it's more likely to be a higher grade glioma, which are unfortunately incurable today. There aren't really any known risk factors other than radiation exposure, toxin exposure, chemicals, which are still relatively rare. The vast majority of people who get these tumors have no known risk factor. People have implicated cell phones and living near high power wires. There are actually areas of the country where they have increased incidence of these tumors basically public health people have gone to look to see what the factors are that might be associated with them. But in general, the very strange thing about glioblastoma or any of these high-grade gliomas is they don't necessarily, the vast majority don't have the typical risk factors associated with like a lung cancer or, solid cancers of the body.
So let me ask you something. One of our friends' daughter at the age of 17 had glioblastoma, and this was such an aggressive cancer that within a year she was gone. She started having some mild symptoms of headaches, occasional nausea. It was ignored. She didn't think it was a big deal. They thought it's basically stress from school. What is the message to a lot of people out there that once in a while they have a headache? Should they be getting like MRIs and CAT scans, or um, without a real treatment and a cure for this disease? What do you tell your patients?
Well, in general, if you did MRIs in every single patient with a headache, you'd be doing a ton of unnecessary studies. And then you always hear stories, these horrible stories, people that all they had was a headache and they find a tumor. So it's hard to balance these two issues. In general, if a headache is okay, if it comes and goes and is one that you're sort of used to. But if you have a headache that's new, or you're not a headachy person, and you get a headache that just keeps getting worse, or particularly a morning headache, one that is worse in the morning when you wake up, that's the more concerning headache, and probably ought to draw the attention of your internist or certainly a neurologist. Other than that, if it's your typical headache symptoms, if you're a headachy person, if you're migraineur, or the headaches are similar in type and consistency what you've always had, then there's really no reason necessarily to study them with MRIs. It's really a waste of time in general.